Moment to prepare the courtroom.
Of course.
Thank you, Your Honor. Doctor, could you please explain to the jury, or please tell the jury your name?
Counselor, can I interrupt you for
Yes.
just one moment? I would like to maintain eye contact with the jury to make sure everybody's awake and attentive and not needing my help. Could you move that to a place where it
Certainly.
would obstruct my view? Thank you.
Is this better?
That's fine, thank you.
I apologize.
No, no problem.
Doctor, could you please state your name for the jury?
My name is Dr. Jackie Ellis.
And what do you do for a living, doctor?
I'm a clinical psychologist.
And could you please tell the jury why you were called to testify here today?
I was called today to make a conclusion about whether or not Lynn Grote was sexually assaulted by Terry Toledo and whether she took her own life as a result of that abuse.
Now, before we get to your opinions in this case and your conclusions, could you please explain where you went to school and your educational background for the jury?
Certainly. I received my bachelor's degree in psychology from the University of Akron in 1979, my master's degree in psychology from the University of Minnesota in 1981, and my PhD in psychology as well from the University of Minnesota in 1985.
Doctor, what courses and what requirements go into a PhD program?
Well, a PhD program is very extensive and it can take up to 7 or 8 years to complete, depending on how long it takes one student to finish his or her dissertation. But generally, students take base classes in personality, behavior, etc., and as they spend more time in the program, they take more specialized courses depending on what their area of interest is. And additionally, students usually partake in a clinical component, which means that they diagnose and treat patients under the supervision of a licensed professional psychologist.
Doctor, we'll return to your training and your education in a moment, but once you obtained your PhD in the field of psychology, what did you do? Did you begin working in the field immediately?
I did. I worked for the Minnesota Department of Corrections for 6 years while I was completing my master's and PhD, and I continued with the Minnesota Department of Corrections 2 years after completing my PhD.
And what kind of work did you do there?
I mostly worked with inmates in both group and one-on-one therapy sessions, addressing various forms of psychological disorders.
And you mentioned that you stopped working there after 7 years. What have you done since then for your living?
I worked in private practice at Ellis & Associates, which is where I work now.
And what do you do there?
I'm a clinical psychologist as well.
Could you describe for the jury what a clinical psychologist means?
Certainly. A clinical psychologist is a general psychologist who is able to treat and diagnose various psychological disorders, depression, emotional problems, behavioral problems, from a variety of causes: emotional, psychological, mental, sexual abuse, etc.
Doctor, you mentioned depression as one of the common symptoms that you work with. Were you trained in your education to spot the signs of depression?
Yes, absolutely, and I do it every day. My practice specializes in general depression disorders.
You also mentioned that sexual abuse is one of the things that you also deal with on a daily basis. Were you trained in your education to spot signs of sexual abuse?
Yes, the PhD program is very intensive, and when we are learning about the different causes of depression, we're taught to look at a wide range, whether it be genetics, a traumatic event, emotional abuse, mental health issues, sexual abuse, etc.
So, doctor, do you feel competent to testify today in court to the signs of depression?
Yes, absolutely. It's what I do every day.
And how about sexual abuse?
Yes, when a patient comes into my office, I might not know why they're there at all, and it's my job to be able to understand what brought them to me in the first place, and that involves discovering whether or not there's any abuse in the history of the patient, including sexual abuse.
Doctor, I want to change gears just for a brief moment, and could you describe, or have you ever written any articles in the field of psychology?
Yes, I've written 3 articles since obtaining my PhD.
And were any of these articles published in peer-reviewed magazines?
Yes, one was published in American Scientific, another was published in Modern American Psychologist, both of which are peer-reviewed journals, and my final article was published in Cosmo magazine in 2007.
Were the two peer-reviewed magazines that you mentioned medical journals?
Yes, they were.
Your Honor, at this time, I tender Dr. Jackie Ellis as an expert in the field of psychology, specifically depression issues and their causes.
Any one here?
Yes, Your Honor, brief one here. Dr. Ellis, you're a clinical psychologist, is that right?
Yes, I am.
Now, at your practice, Ellis and Associates, you specialize in sleeping disorders, eating disorders, and general depression disorders, is that right?
Yes, most of the cases I see involve those specific disorders.
You do not specialize in sexual abuse, do you?
It's not a specialty, but I have seen patients who have been sexually abused.
But you do not specialize in it?
No, I do not.
Now, since obtaining your PhD, you've mentioned that you've published a number of articles,
That's right, yes.
and none of those articles specialize and analyze sexual abuse, do they?
No, my articles do not.
One article, for example, analyzes eating disorders in young women between the ages of 20 and 25. Is that right?
Yes, that's right.
Another analyzes sleeping disorders in adults over the age of 40.
Correct.
And you have never specifically analyzed or reviewed or written an article about sexual abuse in children, have you?
No, I have not written an article about that, but I am working on a book about Terry Toledo where I will discuss the results of child sexual abuse.
Your Honor, at this time, the defense does not object to Dr. Ellis as an expert in the field of general depression disorders, but this is a sexual abuse case. And as the witness just testified, she does not specialize in sexual abuse, and she has only written 2 scholarly articles in her time as a psychologist, both of which do not involve sexual abuse. And therefore, the defense objects to this witness testifying in total, as her expertise, education, and experience would not be within the spirit of 702.
Your Honor, may I respond?
Yes.
Dr. Ellis just testified that she was clearly educated and trained on the issues of depression and spotting their causes, and one of those causes is sexual abuse. Dr. Ellis has 15 years experience in the field of psychology and has worked with patients, as she testified, on numerous occasions and suffering from all sorts of depression issues. Per the 702 test, Your Honor, Dr. Ellis has demonstrated that she has more than enough qualifications for educational purposes. She has a master's in psychology as well as a PhD, and that program was very intensive in covering all the ranges of types of depression and sexual abuse. Furthermore, Your Honor, we demonstrated that Dr. Ellis has training under 702 to spot these signs, and per her education and her experience in the field, we believe that she's more than qualified to testify and aid the trier effect in this case.
What I would like to do is take a 5-minute recess.